Mumps, a disease characterized by puffy cheeks and fever, has been a childhood nuisance for centuries. While less common today due to widespread vaccination, understanding its history, causes, symptoms, and management remains important. This comprehensive dive into mumps will explore the disease from its historical roots to modern-day prevention and treatment. A journey through time, mumps through the ages. Mumps has likely plagued humankind for millennia, with some suggesting references to the disease appear in ancient Greek and Roman texts. However, definitive identification remains elusive. The first clear description of mumps is attributed to Hippocrates, the father of medicine, around 4th century BC. He described the characteristic facial swelling and its association with fever. Fast forward to the 17th century, Danish physician Niels Stensen provided a more detailed account, recognizing the involvement of the parotid glands, salivary glands located near the jaw, and naming the condition epidemic parotitis. Mumps remained an enigma for centuries, with its viral cause unknown until the 20th century. In 1934, Dr. Ernest Weller and colleagues isolated the mumps virus, paving the way for future advancements in diagnosis, prevention, and treatment. The pre-vaccination era witnessed frequent mumps outbreaks, particularly during childhood. These outbreaks often coincided with spring and early summer and were a common childhood experience. The social disruption caused by mumps led to the saying measles, mumps, and rubella, highlighting these three prevalent childhood infections. The culprit: unveiling the mumps virus. Mumps is caused by the mumps virus, a member of the paramyxovirus family. This single-stranded RNA virus infects the salivary glands and can also spread to other tissues in the body. The virus is highly contagious and spreads through contact with respiratory droplets expelled by coughing, sneezing, or talking. Sharing utensils, drinks, or close contact with an infected individual can also facilitate transmission. The mumps virus has a particular affinity for the parotid glands, leading to the characteristic swelling. However, it can also infect other organs, potentially causing complications. Mumps unveiled: signs and symptoms. Mumps typically presents with a spectrum of symptoms, ranging from mild to severe. The incubation period, the time between exposure and the appearance of symptoms, averages 16-18 days, with a range of 12-25 days. The initial phase often presents with non-specific symptoms that could be mistaken for a common cold or flu. These may include fever, headache, malaise, general feeling of being unwell, muscle aches. Loss of appetite. Within a day or two of these initial symptoms, the hallmark feature of mumps often appears: parotitis, or swelling of the parotid glands. This swelling manifests as puffy cheeks, particularly on one or both sides, and tenderness in the jaw area. The swelling may push the earlobe upwards and make the jawline appear less defined. Other less common symptoms of mumps can include earache, swollen lymph nodes in the neck, pain when chewing or swallowing, dry mouth. It's important to note that not everyone with mumps experiences all these symptoms. In fact, some individuals may have no noticeable symptoms at all, asymptomatic. This can make mumps challenging to diagnose and contribute to its spread. Complications of mumps: when the puffy cheeks become a concern. While typically a self-limited illness, mumps can occasionally lead to complications. These complications are more frequent in adults compared to children. Some potential complications include orchitis, inflammation of the testicles. This is the most common complication in males after puberty and can cause pain, swelling, and in rare cases, temporary or permanent infertility. Oophorytis, inflammation of the ovaries. This complication can occur in females after puberty and may cause pelvic pain. Meningitis, inflammation of the membrane surrounding the brain and spinal cord. This can cause severe headache, fever, stiff neck, nausea, and vomiting. While uncommon, mumps meningitis is usually a mild illness and resolves without long-term effects. Deafness. This is a rare complication but can be permanent. Encephalitis, inflammation of the brain. This is another rare complication that can cause confusion, seizures, and coma. Pregnant women who contract mumps during the first trimester have a slightly increased risk of miscarriage.